Kanan Kumar, and this is Plexus Ortho, and today we're going to be discussing a very important topic, septic arthritis. We're going to be focusing on pediatric septic arthritis and mostly of the hip, and this can be extrapolated to other joints as well in your exam, right? So pediatric septic arthritis is basically an intra-articular infection in children that peaks in the first few years of life, and the diagnosis is mainly made by a combination of history, physical examination, imaging, and laboratory studies, and the so-called Cocker criteria, which we will discuss in more detail, which is very important for diagnosis and treatment of septic arthritis. The incidence is about 4 to 5 per 1 lakh children annually, right? Now, what is the pathophysiology and how does it occur? The mechanisms in which the septic arthritis occur. One of the mechanisms is inoculation. How does it happen? When you inject into the joint, for example, in some kind of shoulder procedure or elbow procedure, or when you're giving an injection in the gluteal region by mistake, when you inject into the joint, it can cause septic arthritis. So inoculation is the first way in which it can occur. The second and the most common way is the hematogenous spread, and because the synovium has no basement membrane, when the child has infection, generalized systemic infection, and most commonly it is a URTI or an LRTI type of infection, when the bacteremia is high in the system, it can lead to hematogenous spread and can eventually lead to the septic arthritis. That is the second mechanism in which can occur. The third mechanism in which it can occur is the concurrent osteomyelitis. All joints, for example, this is an elbow joint, many of the joints, the metaphysis is intra-articular. So the osteomyelitis infection can spread inside and become an septic arthritis. In the shoulder, the osteomyelitis, the metaphysis is intra-articular. In the ankle, the metaphysis is intra-articular. The hip, the metaphysis is intra-articular. But what is not major, which major joint is not intra-articular? The knee joint is not intra-articular, and therefore the osteomyelitis from the knee cannot spread into the osteomyelitis from the metaphysis of the tibia or the femur cannot spread and cause septic arthritis. This is a important thing that we have to remember. The other risk factors for septic arthritis include premature babies, right? Premature babies who have been in the ICU for a long time, right? Caesarean section babies for some reason seem to have a higher incidence of septic arthritis. Children who have had some interventions like catheterization and other central lines or all other invasive procedures which are done in children are more prone to develop septic arthritis. This must be kept in your mind when you're answering these questions. Right. So in septic arthritis, what happens? The cartilage gets destroyed very quickly. This cartilage destruction occurs in two phases. The glycosaminoglycans like chondroitin sulfate and keratin sulfate are lost very early within 48 hours, and the collagen is lost late in about 3 weeks of time. So it occurs in two phases. Septic arthritis causes cartilage damage very quickly with devastating consequences to the child. Staphylococcus aureus has some unique properties. Staphylococcus aureus is the most common organism which causes septic arthritis. This must be remembered, right? And because of certain binding gene and other characteristics, the septic arthritis is more frequently caused by Staph aureus. Staph aureus is what type of organism? It is a grape-like. It is in a gram-positive grape-like bunch appearance, cocci, right? So it's a Staph aureus. Staph aureus is the most common cause of septic arthritis in any age, no matter what. In any age, no matter what, Staphylococcus aureus is the most common organism. So as we said in this slide, it says Staph. So that means Staph aureus. Doesn't matter in any age because of immunization and other factors which play a role. All other organisms have taken a back seat, and it doesn't matter if the age is 0 or if the age is 80 years old. The most common organism, or the first common organism you should write in your exam and MCQs is Staphylococcus aureus. There are special circumstances where other organisms may be involved, but even in all those age groups, Staph aureus is first and the other organisms are second. What are some of the other pathogens? In neonate, we have Streptococcus, group B Streptococcus very specifically. Group B Streptococcus, and some gram-negative organisms like Kingella kingae and other organisms can also cause in neonates. And also you must be aware of multifocal disease because multiple pathogens may be involved in one septic arthritis pathology. Hemophilus influenzae has come down because of vaccination, and Kingella kingae also can be seen, which which needs special culture, needs a carbon dioxide enriched or anaerobic culture to raise these organisms. So therefore, don't be surprised when they don't grow in the normal medium. And you must also remember these two special circumstances where we have sickle cell disease and MRSA, right? Which is the most common organism in sickle cell disease? Salmonella. Salmonella causes the most common osteomyelitis, and if it spreads into the joint, can cause septic arthritis as well. MRSA or methicillin-resistant Staph aureus should also be taken care of because the antibiotics that must be given for this is different and special, right? So clinical evaluation. So history and examination is very important. Child may not be able to bear weight. Very important. Not able to, in a walking child may not be able to bear weight. In a neonate, the child keeps the hip in flexion, abduction and external rotation. Why does this happen? In any condition involving the hip problem, the child tends to go into this kind of a position, or the hip goes into this kind of position, that is flexion, abduction, external rotation, because this is where it can accommodate most amount of fluid or pus in the joint. They have severe pain, and sometimes in neonates where they cannot complain about pain, they are lethargic, and they may also be in sepsis sometimes, right? If the diagnosis is delayed, they may be septic and toxic in appearance as well. So first thing we have to get plain films. What do you see in plain films? When you see plain films, if this is the femur, because of the filling up of fluid, the joint appears more distended, or there is more joint space compared to the opposite side. Compared to the opposite side, the femoral head looks pushed out and there is more space in the joint. So this is an indication in plain x-rays of septic arthritis in the joint, or it is filled up with pus, right? Then you should always do blood investigations. Blood investigations will show up an increase in the total leukocyte count, and with more than 75% of it will be polymorphonuclear cells. So these are the two things that you will see in blood investigations. You can also do a blood culture, which may grow the organism responsible for the septic arthritis. CRP is of course increased quite drastically. ESR is also increased quite drastically. So next you have to do, if you suspect clinical evaluation septic arthritis, you have to aspirate. So what will the aspirate show? It will show very high blood count. This is not in the blood, this is in the aspirate. It will show more than 50,000 high blood count with more than 75% polymorphonuclear cells, right? Glucose of 50 milligram per deciliter or less than serum levels. High lactic acid with infections due to gram-positive cocci or gram-negative rods can also be seen. So what is seen in the synovial fluid or so-called pus aspirate from the hip joint, you can see more than 50,000 count of the WBC, so with 75% polymorphonuclear cells, glucose 50 milligram per deciliter, and a very high lactic acid levels. So who needs surgery, right? Who needs surgery? What are the criteria which we use to determine who requires surgery? It is a Cocker's criteria. This is the one which is used very commonly. It is very important. You must understand this Cocker's criteria. In the blood level of more than 12,000, total leukocyte count of more than white blood cell count of more than 12,000 in the blood cell in the blood is a strong predictor. Is one of the criteria. The second criteria is inability to bear weight. The third criteria is fever more than 101.3 degree Fahrenheit, and the fourth criteria is ESR more than 40 millimeters per hour. It has been shown that if four of these criteria are positive, then there is a 99.6% chance of septic arthritis. So you have to think of this as a septic arthritis and go ahead and treat it either with observation and close observation and IV antibiotics, appropriate IV antibiotics, or if the pus formation is quite a lot and it is not getting better with IV antibiotics, you have to do a arthrotomy and release the pus to avoid devastating later complications. So to these original 4 Cocker criteria, a new criteria has been added, CRP, a C-reactive protein. An increase in the C-reactive protein also is a good indicator for septic arthritis. It gives an additional benefit to these above 4 criteria. So what are the 4 above criteria that we know of? One is count more than 12,000, white blood cell count more than 12,000, inability to bear weight, fever is more than 101.3 degree Fahrenheit, and ESR is more than 40 millimeters per hour. These are the 4 original criteria. One additional criteria now is a CRP that has been added to this. So if you first thing, when you find this Cocker criteria, you have to treat it with observation, close observation. You have to admit the patient and give appropriate empirical antibiotics to treat Staph aureus initially, and over a period, once you get some evidence of culture or aspirate the material and get some histological staining giving some confirmation of the organism, then you can give appropriate antibiotics. Till then you have to give empirical IV antibiotics. If this fails within a day or two for the symptoms to reduce, or or the child is not getting better very quickly, then you have to immediately do a surgical release arthrotomy and make sure that there is no pus or infective material left in the joint. A thorough wash must be given. Why must this be done? Otherwise the joint and the cartilage gets completely destroyed, as I said, within the first 48 hours. Then the collagen gets destroyed and the whole joint will be completely destroyed, and the child will have a terrible time when as he or she grows up. So this is an important thing, to early and quickly manage these septic arthritis, right? So there are some controversies whether to do open or arthroscopic. You can write both these in your exam. You don't have to worry about the controversy. In your case, maybe you can just do an open arthrotomy, right? You have to describe this. You may be shown an X-ray of a burnt out septic arthritis, or in a 12-year-old or a 15-year-old child, and then you have to give your opinion about what should have been done and what is the consequence of this. We will discuss in another video regarding the consequences of failure to do hip arthrotomy or manage septic arthritis effectively, right? So that concludes our talk on septic arthritis in the hip, especially pediatric. Hopefully with this you can answer questions regarding this both in your theory and viva voce. Thank you very much.